So our project is on the impacts of functional neurological disorder management. My name is Chloe Gare.
My name is Isabel Aguilar.
My name is Kelly Deep.
My name is Simona Yasbudis.
My name is Sneha Dadapanini.
I'm Shrija Katuka.
And I'm Navya Vijay.
Now, by a show of hands, who here has been in a hospital? Now, by a show of hands, who here enjoys being sick in the hospital? Now, visualize that you are laying in a hospital bed. You are in an immense amount of pain and doctors cannot explain why. All tests are coming back negative, yet the pain is getting worse. This is the unfortunate reality for so many patients with functional neurological disorder. This is why we decided to propose our question. What are the implications for treating functional neurological disorders that are diagnosed without a clear structural cause? Should medical professionals invest in research to improve functional neurological disorder treatment? Now, throughout the years, healthcare has allowed for several discoveries. However, when it comes to diseases such as functional neurological disorder or FND, it seems to be tossed aside. Because of this, people are likely to be misdiagnosed while being transferred doctor to doctor. This common occurrence causes detrimental effects to patients with this condition, and today we are here to explain why. So, functional neurological disorder is a debilitating neurological movement disorder with no structural cause. The symptoms include blindness, seizures, paralysis, behavioral changes, mutism, chronic pain, and much, much more.
For years, physicians have had a hard time distinguishing FND as a neurological condition versus a psychological one, when in reality, it is a combination of both. Until recently, it was called conversion disorder, although the term continued to evolve to explain the physical symptoms. There continues to be a strong stigma towards FND towards it due to its psychological components and no material proof. Individuals with FND struggle with how their brain sends and receives information. It is a condition where individuals experience neurological symptoms without any underlying structural cause. While the exact cause of FND is unknown, doctors believe that there are a few possible ones, such as previous illnesses and emotional or psychiatric components.
Moving on to key issues, we must first discuss the Western medical paradigm. This bottom-up strategy consists of building off of symptoms and then diagnosing based on those symptoms. They include using diagnostic tools, examining pathology, genetics, and physical symptoms. Regarding FND, however, the symptoms and the disorder itself, there's no correlation between the two. Since this is a systems-level disorder, experts need to turn to a top-down causality, where they use physical, psychosocial influences and analyze brain function in order to make a more correct diagnosis. Going back up to the bottom-up strategy, it comes with many misconceptions and a lack of education from many healthcare providers. A survey done by the Cleveland Clinic Foundation asked several ER providers how much knowledge they had on FND. A staggering 95% of them reported a lack of knowledge on FND disorders. This, in combination with the limited diagnostic tests, lead to the common issue of misdiagnosing. Misdiagnosing patients will affect their experience in the hospital, as well as delay their treatment and put them in a hostile environment. The confusion as to where these patients should be placed, often in neurology or psychiatry departments, offers them no guidance whatsoever. This borderlines medical malpractice, but our very first priority should always be caring about the patient.
Medical professionals of many practices will turn down patients and continue a vicious cycle where it leaves patients without any clear, honest treatment. Then they look for answers. And then they have to go to the next one, and then they look for answers with the next specialist. And then it repeats with the next one because multiple medical professionals evade FND patients looking for treatment and support. This leaves the patient feeling rejected, invalid, neglected, and just generally emotionally manipulated. These people then start to question themselves and their pain, depression, and anxiety start to rise as they wonder, is it all in their head? It isn't. They aren't invalid. They deserve to know that, and they don't deserve the neglect they commonly receive. The mistrust and gaslighting does not only traumatize patients, they feel degraded as human beings. Along with that, when being emotionally neglected and told what they are feeling is physically incorrect, feelings of invalidation affect interpersonal and intrapersonal relationships may be developed. Eating disorders, post-traumatic stress disorder, emotional unavailability, they all have increased chances of happening, and while the patient faces brutal responses. Therefore, those suffering from FND must be guided to the right direction to prevent all the emotional harm from piling up.
Functional neurological disorder has not yet been visualized or tracked through tests or neuroimaging scans. Well, that is until recently. Tentative functional magnetic resonance imaging, or fMRI, studies now show patterns of node networks and abnormalities in the emotional and sensory motor regions of the brain. Well, you may ask, why is this important? If we invest in researching more about fMRIs, there is a potential to develop biomarkers to accurately diagnose patients with verifiable methods. However, despite this, accessibility to specialized care remains a significant challenge. fMRIs and FND specialists are commonly found in urban areas, leaving many facilities in less developed regions to use traditional clinical tests which do not provide the necessary treatment and leads to worsened physical and emotional symptoms. As treatments are expensive and the majority of insurance companies do not cover FND, many individuals with lower socioeconomic statuses face neglect and high debts.
FND is a very complicated disorder, but there are ways to help the patients without having to deal with the issues. Our first solution that we want to propose is to educate and spread awareness about what FND is like. One way to do this is through patient-provider education sessions. This would inform patients on what their diagnosis is exactly instead of confusing them. It would also enlighten physicians and insurance companies on how to best help the patients. Another solution we have regarding the lack of knowledge around FND is to include more lessons on this disorder in medical school. This way, future healthcare professionals are prepared to work with these patients. A different approach that we have, more centered around the treatment, is to create a multidisciplinary team. This way, everyone can find ways to treat the patient with their own specialized knowledge. This team would include neurologists, occupational therapists, physiotherapists, psychiatrists, psychologists, and speech therapists, depending on what the patient needs. This would also prevent the shunning of one patient from one department to another and instead would bring them all together.
In addition to multidisciplinary teams, we propose establishing a multidisciplinary clinic. The multidisciplinary model has been adapted from multidisciplinary pain management clinics that have proven to have positive effects on the patient's pain management and better treatment options than the typical healthcare system. The development of multidisciplinary FND clinics will allow patients to receive care from its team of specialized FND specialists to determine proper treatment and possibly more functional biomarkers. In addition, currently specialists in FND are sparse and mainly located in university or research settings. The creation of multidisciplinary FND clinics will make treatment more accessible and individualized for everyone. However, in order to fully comprehend and explain the cause of FND, the current approach to education and treatment needs to be improved. We propose treatment pathways such as an accelerated resolution therapy and emphasizing the need for more research in order to discover more biomarkers. In addition, as stated before, fMRIs can show some patterns for FND, but they are still incredibly inaccessible to patients. To fully utilize fMRIs for FND treatment, its technological availability and accessibility should be distributed to allow everyone to have access to the resources and treatment they need. Hopefully in the future, using fMRIs we can learn more about the specific areas of the brain that are affected and be able to use neuro wearables or transcranial magnetic stimulation to help treat it. This is a visual for our proposed algorithm. We start with education, which splits off into provider and physician education and then patient education. So looking at the right side, we want to educate physicians and providers about the treatment pathways that I mentioned before, and encourage/inform them about funding and the need for funding. Moving on, we want to educate them about multidisciplinary FND clinics and about how we can get patients the proper treatment that they need. We also wanted to highlight the left side, stressing the patient education aspect as validating their symptoms and their FND diagnosis can help start to eradicate the stigma around FND and can help them stop the discrimination that patients face in the healthcare system.
As we previously mentioned, there should be an increase in FND funding and research. A multidisciplinary team needs to be created to combine their specialties to provide better treatment and a more effective plan. However, some might ask that if FND is rare, should we not use resources towards other disorders that are more common? First of all, FND should not be considered rare because of the limited treatment and approaches needed to combat this disorder. Just because it is an uncommon disorder that affects a smaller population, it does not take away the importance of being able to properly treat and assess the patient, as their symptoms are very much real. This brings up the question of who decides which life is more important? Why should the lives of others' diseases matter more than the ones impacted by FND? Supporting research and specialized care for the disorders like FND is a step towards addressing healthcare inequalities and build a more inclusive healthcare system.
Thank you to everyone for listening. Thank you so much for Leadership Initiatives. Thank you so much for the amazing panel in front of us. Thank you for teaching us and mentoring us. And thank you so much to the best team lead ever, Nadia. Thank you.
Okay, so hello. Wow, what a wonderful presentation. So speaking as a psychiatrist, you hit on one of the most important issues I think facing the field. It's absolutely underappreciated, and speaking from experience, even in very high-profile academic hospitals, the lack of awareness and education and a lack of awareness of the treatment pathways that you described, like that is very real. And you cited research to indicate that, which I think was really valuable, right? Because I mean, I know this as I've experienced it, but not everybody does. And so you're citing that research, which is grounding this. I think it's very important. So I really liked the plan. You thought through this. You thought about the stakeholders, but you also centered your presentation on the lived experience of the suffering patient, right? The person who is suffering this the FND. So I think that was a really a nice touch, because these people are being kind of left behind in a way in our system. At the same time, we have to engage all of these different stakeholders to make a change. And so you did that really nicely. And you even raised the concept or the stakeholder of the insurance companies, which is very much playing a role in this kind of healthcare ecosystem that's not enabling, a path forward really, right? So I think that was wonderful. I think the multidisciplinary treatment team that you describe is exactly what's needed. And there are very few trying to do this in the country. At Harvard, Mass General, they have one, and they're just all too infrequent. And I think nobody's really thinking about how can a proper team like that be scaled. And that's what you also brought up too, the importance of like scaling this in such a way that it can reach, the ethical issue of justice, of distributive justice, that, you know, this issue, though rare, is it's a very important one. These are people who are not being, you know, well served, and so you really thought about that. I could go on. I think this was excellent. I want to give everyone else a chance, but great work from my point of view. Wonderful.
Thank you all, did a really, really excellent job. What I really loved about this presentation was your emphasis and thinking through the systems level approach, bringing forward that the fact that the fMRI data really was showing network effects and differences in node edge network effects in these. And what that really does is it provides a potential hypothesis for how functional disorder can still be linked or at least reflected in the neurological activity, but something about it is occurring, not rising up from you know, the organic substrate, but from a systems level and having the effect down. But then again, what in consciousness doesn't also work that way, right? And so bringing that forward, I think, is really quite brilliant. You tied it together, and you really pointed out the way that having fMRI studies is not just from the scientific perspective, the light that it can shed on FND, but you really captured the importance of, in the system that we are, you know, there's not a lot of fMRI is not used, you know, this data gets interpreted in such a way that's not necessarily reflective of what it's actually showing, but it does confer a level of legitimacy. And as soon as there's a neural correlate discovered, it's considered quote unquote real, right? And so there's no reason, I don't think there's ever been a reason to think that there wouldn't be something that could be seen with FND, but pointing out that that is the currency in order to get it into the system where it can get access to treatment. Very well highlighted, very well thought out. I thought this was really excellent.
Well, bravo. And you had me at the second slide. I mean, the whole thing was so slick. It was academic, it was professional. If something like this done in, oh, I don't know, 2,000 words with your slides would not be out of place in the kinds of professional journals. And in fact, we've seen much worse done with twice as much space to less effect. Really organized, structural, you had process, you had frameworks, and it just rang clear as a bell. And if you asked me, well, where was the neuroethics in all of this? Well, it was at the beginning, it was the end. Every single phase of it advanced a neuroethical agenda that is needed more than ever today, I think. So bravo.
Yeah, I really liked it a lot. I mean, I think as Dr. Rossi told you, and certainly as Dr. Wertzman brought to the fore, this is an important problem, because what we're seeing is that the way functional neurological disorders are presenting a little bit more vague, number one. Number two is becoming a little more diversified. So being able to say, look, I mean, we recognize this is a multi-headed beast, and being able to visualize those things and therefore give them some credibility, very, very important to do. And I also do like that you stressed a model of multidisciplinary care, because the failure of multidisciplinary care has been shown otherwise, as we discussed with regard to pain clinics, and then bringing that idea back in as something that grows out of the brain initiative, brilliant to do. If nothing else, just using functional neurological disorder to re-emphasize how multidisciplinary centers might be useful to integrate psychiatric and neurological care, appreciating the biopsychosocial nature of both the person and their disorder. I agree with Dr. Shook that this, I think a nice tight little commentary paper might be very, very cool to do. So that's where I like to see this go. Bravo, ladies, you did a great job.